My name is Michael Demansky, Senior Physiotherapist at MD Health. I'm going to talk about SIJ pain in pregnancy. SIJ pain is probably the most common reason for lower back pain during pregnancy. It occurs because as you get more pregnant, the ligaments relax and it allows the most amount of movement that you would normally ever get in the sacroiliac joint, which is around the bottom, around here. Now, it's fine if you don't have good strength around your gluteus maximus muscles or your bottom muscles in other times. When you add pregnancy onto it too, that's often when we start to see SIJ pain. And it can persist after you've had the baby after pregnancy as well. So when we see people with SIJ pain in our clinic, these are the first couple of exercises we would start with them. The first one is to get those muscles to activate around the bottom without using just one leg, because that puts too much pressure on one particular SIJ. So this is the first one I will do. So hand on the reformer, small arch in the back, tummy muscles in. From there, pushing the carriage out with both legs. You want a slightly heavier weight with this one because you really want the bottom muscles to switch on. Tummy muscles in, lifting one leg up in the air, one hand up in the air, other hand up in the air. And then coming back into the hips. That allows the weight distribution to change around the hips and get those bottom muscles to switch on without putting too much pressure on. We'll try that again. Again, out with both legs, tummy muscles in, one hand up, other hand up, and then back in. So exercise number one. When it starts to settle down a little bit, we want more direct exercises to work on the bottom muscles. So standing up next to the reformer, shoulders back, tummy in. From there, this foot has to be a little bit further back. So when you push back with this leg, it goes up to neutral only. So pushing the carriage back, holding it so the legs are together, parallel, holding it for 2, 1, 2, and back in. And that's a more direct way of getting the gluteus maximus to the bottom muscles working. Very, very important during pregnancy. We start with the basics, do it safer, and so there's more support, and then we slowly take the support away as you get stronger. So that a way of doing this at home, back down on the ground, small arch in the back, tummy muscles in, and again, similar to what we did on the reformer, one hand up, good, other hand up. And it gets those muscles around the back and the bottom to activate without too much pressure on them too. And as it gets easier, small arch in the back, tummy in, one leg up in the air, hold the leg up. 1, 2, 3, 4, 5. We want those bottom muscles to work, and that's why we hold it for a little bit longer. 1, 2, 3, 4, 5, and back down. And it should get those bottom muscles working, so the SIJ pain should be less after the exercises than when you start, and then you know you're doing it properly. Thank you.